and come to join me in this discussion. I am going to be looking down and trying to share so it can reach as many people as possible. I am going to start pouring, with the very poor and boring information at the beginning. Sure, all of you know what we are going to be discussing, but there is some point that we have to talk about and address. Um, I am going to share some while waiting for you guys to join me. Um, so if any of you are here, let me know if you can hear and if it's clear. All right, so I see there is 11 people already, but I don't see you here on the computer. So let's talk about the scare and a scary situation that we're living in. I know everyone is scared right now, and we all know the unknown is scary. But please take a moment to understand how viruses work. And that's part of what we're going to be talking about now. Understand what viruses work, try to understand the facts behind any disease and how bacteria function or how viruses. Don't cave in and give in to the scare tactic or what you just hear from the media. And I know we are part of the media also, but don't just hear it. Do your own research and try to understand and see the fact. There is the CDC website has more accurate information, up-to-date information. You're going to hear a lot of news conference regarding this issue. But what we need to understand in simple terms, and I'm going to try to talk in simple terms, not in medical terms as much as possible. But viruses are very, very tiny organisms. They are made of genetic material. The genetic material is inside of a protein, like a tiny, tiny, small organism. So the viruses cause familiar infections that you all know and heard of before, like the common cold, the flu, the warts, and they also cause some severe diseases such as HIV, AIDS, smallpox, or Ebola. But they are like an unwanted guest. If you think of it, just think of the viruses are unwanted guest or hijacker. They invade your living normal cells and use those cells to multiply and produce other viruses like themselves. And that's what can kill and damage or change the cells and make you sick. But you need to understand that the viruses themselves are not incapable of reproducing on their own. So the viruses are incapable of reproducing on their own. The viruses depend on an organism just like you and I for their survival. So if they don't find that host, they're not going to survive. They're just going to stay dormant and they will die eventually based on what kind of viruses we're talking about. So they can kill and damage the cells, but whose cells? There's few people are at risk, like higher risk, older population, people with compromised immune system. Because your body, normally when you get the virus, your body start to fight the infection by itself. That's why there is no medication for viruses, except there is viral medication that you can get for a specific kind of virus infection, but there is no other treatment. So every medication that you will get when you have a viral infection, if it's not a viral a specific medication, it will be medication that address the symptoms. It is not going to make you feel better faster, or it's going to get rid of that virus. Unless, like I said, there is specific viruses that has medication. That's why we urge people to vaccine. their self and use vaccine all the time. Make sure you are vaccinated. And I know a lot of people out there don't believe in vaccines and they try to use natural remedies. I'm not trying to challenge your beliefs, but I'm trying to tell you, if the science work hard and get you to this point and got us some vaccination to help us not die or not suffer severe consequences, why can't we use that? So basically, let's go back. They survive on you and me. They have to invade you and survive on being inside of a host. If you get a virus infection, your body normally tries to fight it, unless you are you have some kind of a chronic medical condition, such as heart disease, lung disease, diabetes, or you have your immune is compromised. And that's why older population are at higher risk. People with cancer, people who have compromised immune system are at higher risk for contracting any virus infection, including the coronavirus. So for most viral infection, treatment can only help with the symptoms while you wait for your immune system to fight it. Antibiotic does not work for viral infection. It works for bacterial infection. There are antiviral medicine that treat some viral infection, but the vaccine is the only way that we know so far. Okay, so with an active viral infection, and like I said, at the beginning, we're going to talk about the boring, the very boring stuff, and then we will talk about the effect of it on the economy, what is happening now with the school closing, and how this is affecting us economically. With the active viral infection, a virus makes copies of itself. It multiplies. Symptom of any viral illness occur as a result of a cell damage. So you start feeling sick if your immune system is compromised, and you start feeling that as the viruses are killing or damaging your cells. Viruses could be inactive or in a latent phase for a while, and there is a viral infection that is contagious for a specific period of time. So you have to know what are you dealing with before you get, I know it is a scary thing. We are always scared when there is no information out there. But we have some information now. Viruses can be transmitted in various ways, like some viruses can spread through touching, saliva, air. This specific virus we're talking about, you have to keep a distance. They said at least 6 feet between you and the other person. If you feel sick, please stay home. And I know you heard that a lot, and you're going to keep hearing it, because there is specific things that you can do. It can prevent the transmission. It can prevent you from making other people contagious, making you infecting other people. There's symptoms that when you feel those symptoms, now they're not asking you to go to the doctors. They want you to call, and most places will be sending you an ambulance to go there. Or you need to call your doctor ahead of time so they can be ready, because you don't want to expose other people to what you have. So we don't panic. The fever at high temperature, 103 or more. There is coughing. You can feel like you have a common cold or a flu symptoms. Most of the hospital now will test for the flu before they can decide it is not flu, and then they can test you for the coronavirus. You will feel shortness of breath. Those are some of the symptoms: high temperature, cough, breathing difficulties. You're going to feel basically what some of the patient describe it like a elephant is sitting in your chest. This could mask some other kind of disease or disorders, but around this time, if you feel any kind of symptoms that will make you suspect you have corona, please contact your doctor. There is currently no vaccine to prevent coronavirus. None. But we are hopeful that soon we will have something to be able to provide and give to people here in the United States or anywhere else. So the best way to prevent illnesses is to avoid being exposed to the virus. And you're going to say this is easy said than done. And it is easy said than done because, again, we're going to talk about if you stay home, how is that going to affect you if you are not able to go to work, if you're not able to pay your bills? Who's going to pay your bills if you stay home? So I know it's easy said than done, but think about it this way. If you go to work and you're sick, how many other people you are going to infect? And then you are going to be sent home. You're going to stay. You're going to lose more time. You better go get tested sooner and there's no treatment, but at least you'll be isolated than other people around you. Between people who are in close contact with another, you have to keep 6 feet, like you said. Stay away from crowded area as much as possible. I know they are scaring us now more than it should be. Again, this is a virus, and I'm going to repeat that until the end of life. This is a virus just like the common cold. The only difference between the coronavirus and the flu, we have a vaccine for flu. We know the flu. The death from flu is more than the death from the coronavirus, but still, it's preventable. So keep at least 6 feet distance between you and someone who might be sick, or just to be cautious from anyone. Wash your hands. And you heard this a lot. Wash your hands often with soap and water. If soap and water is not available, then use hand sanitizer. Wash it for at least 20 seconds. A lot of people wash their hands and think it's like just washing my hands with water and go. You have to do 20 seconds. Normally they say sing happy birthday. You can sing any song from the 90s, the short version, but make sure it is 20 seconds or more. More is better. If there is no soap or water available, then you can use the hand sanitizer, but use one with 60% alcohol at least. If if you are touching, you're out and you're touching an elevator or you're touching any surface, it stays in a metal surface for, I believe, 20 days. I believe, I'm not sure. I'm going to look up that and let you know. But if you are supposed, or if you have to touch a surface, please use a barrier. Touch it with something. Avoid touching your eyes. Avoid touching your nose and mouth with unwashed hand. If you touch anything, wash your hands directly. Don't touch your face. Keep away from this area. Eyes, nose, and mouth. Keep away. Wash your hands. Again, wash your hand. Avoid close contact with people who are sick. If there is someone sick in your area, someone sick at your job, please keep away from them as much as possible. Wear face mask if you are sick. And I cannot repeat this enough. We are in healthcare, the front line personnel, the police, the nurses, the doctors, anyone in healthcare, they are exposed every single day to other diseases. They need the mask. They need the hand sanitizer. When you guys go out there, panic and buy everything in the store. Now, if you go to any store, you're not going to find anything that healthcare professionals need to use to survive. You don't need to wear the mask unless you are near someone sick. You don't need to wear the mask if you are not sick. Like I said, you cannot just buy and store and wear a mask and think this is going to help you, because now you're depriving someone who's in need. This is selfishness. There is people who have cancer. Their immune system is already compromised. There is elderly patient. They're elderly. They're your mom, your grandma, older people out there who need to use the mask because their immune system is not like you and I. So, hey, Stephen, hey, Lisa. So when like half of my nurses friends are here listening, and they can all attest to that, they are struggling. They are facing death. They are facing other disease and disorders when they go every day. You can call off if your job is not you are not a frontline personnel, or you are not a first responder, but an ambulance person cannot call off. You know why? Because when you are sick and you are needing immediate attention, you need that ambulance when you call 911 to get to you as fast as they can. If they don't, if they're sick or they don't have masks, they don't have sanitizers, they're going to get sick themselves. So by being selfish and buying everything in the store when you don't need all that, you are depriving other people from getting what they need to do the job, to get the job done. And you know what's going to happen? More people are going to get infected because they're not protected. You are staying home, you don't need masks unless you're going in a place that you are going to be sick, or you're going to face sick people. Again, please do not panic. Do not wear masks if you are not sick. Refrain from sharing food. And there is a lot of people who will think it's, this is okay. They will share their drinks now. I mean, before, if that's your choice, no one is going to stop you. I advise against it, but no one is going to stop you and say, don't share your food with your family or your friends. But now around this time, please refrain from sharing food with others. Excuse yourself from shaking hands. You don't have to shake hands. You can say hello, be honest with others. And I'm sure everyone wants to be safe just like you. On the screen, if you see what we have written there, worldwide, there is 132,536 confirmed cases as of today in 123 countries. There is 4,947 deaths, with 31 US deaths as of today. That 31 number I got earlier today, I'm not sure if it is still the case, but it is getting up there. And I think part of it is people panicking. And when you panic and you get in a panic mode, you don't think correct. And you do things like, people go out and buy a bunch of stuff that they don't need. Again, if you're sick, you do not need to wear, if you're not sick, you do not need to wear a face mask. If you're sick, stay home, please. If you can't stay home for any reason, wear face masks. Stay home unless you're going to the doctors. When you are going to the doctors, call ahead so they can get ready, so they can be prepared for you. So you don't infect us. You don't infect the nurses. You don't infect the doctors. You don't infect your EMT guy, the ambulance person. Face mask may be in short supplies, like we all know now, and they should be saved for caregiver. Again, your house need to be clean and disinfect. Use just the normal disinfectant at your home. It's sufficient enough. If someone in your household is sick, even if it doesn't sound like the coronavirus, but if they're sick with cold or flu or something, make sure you practice hand hygiene, not because they're your children or they're your spouse. You're just going to not practice the same safety measures. Avoid sharing personal household items with your family or your friends. Monitor your symptoms. If you have the symptoms we just talked about, if you have high fever, if you have cough, breathing difficulty, then call your doctor right away. be prepared if your child's school or child care facilities is temporarily dismissed. And we all know here in Pennsylvania, they close all the schools from Monday, next Monday, the 16th, all the way to the end of March, March 30th. The school is closed. And this, guys, will affect us highly. I'm not talking about the virus. And I'm going to say something that, you are all might be surprised to hear, or you thought of and didn't think it's going to affect us that much. But we could all get hurt from the economic instability we are facing now. We are all going to be affected and face more issues with bankruptcy, face more issues with being unable to pay our bills, have babysittings, childcare. All the kids are going to be home. There is single parents out there who don't have any option, don't have families to help them. And what are they going to do? You are not going to be able to go to work, not because you're sick, because the school is closed now in that panic, and now you don't have someone to watch your kids. So what are we going to do? That's okay. No, I am going to share what you just posted, Steve. Here, I'm gonna put this up here. Stephen Najah, know that you won't know who has it. You're looking at them. Precaution, precaution, hand washing. Yes, dear. You have to be cautious. You have to be careful when it comes to dealing with others that you don't know. But I think the biggest issue that I think we are facing now is the school closing. Some of us might be unable to go to work, like a lot of people actually. And on our show last time, I said the mayor, New York mayor, asked everyone to stay home. And I know it is a precaution measure, but who is going to pay those people's bill? Who's going to pay their rent, their mortgage, their food, everything else that they need? That's a question. And I'm sure some of you out there are having this issue. You probably heard today that the school is closing. So what is your options? What are you going to do? If you have kids and you have to attend and go to work, what are you going to do? Be informed, know the fact, but don't panic. And we are in a panic mode right now. I am not an optimist, I'm not an optimist. I'm an optimist. I like to view the glass half full, but at the same time, I like to be realistic as much as possible. And with everything going on now, I see a lot of people are going to the extreme. Some people are thinking this is the end of the world and they're panicking, they're going out, buying everything. And other people are looking at it and saying it's a hoax. Just like when we talk about global warming, a lot of people do say, oh, this is not real. So we have two types of people now, extremists. Some people think this is the end and some people don't think it's important. So both of them are very dangerous. The one that thinks it's the end of the world, they're going to take extreme measures, which they're doing now, buying everything. At the same time, there is a lot of people are going to benefit, from this. Basically, some people are going to buy all the material and keep it and then sell it for a higher price. So this time is really a hard time, and we have to all stick together and try to get to the end of this epidemic without losing a lot. When I say losing, I'm talking about losing lives, losing money, and having to suffer a lot of consequences. So, again, I need to hear what you guys think about what are we going to do? What are we going to do as parent? What are you going to do in order for you to be able to go to work? Do you have some help, or are you going to contact your government officials and ask for help or suggestions? So the economy, or the economic complication for closing the schools, colleges, especially for working families, the homeless population. You know that there is a lot of kids that go to school and they are homeless. The only meals that they receive the whole day is the breakfast and lunch, the free breakfast and lunch that they get from school. So when their school is closing, what are they going to do? That's one thing we all need to think about. When you do you, please think of others. Closing the school, it doesn't just affect you economically, and it's not going to just prevent you from going to work, and you're gonna end up maybe losing your house or losing other things. But there is other people are already in this situation. There is students that are homeless and they're depending on the meals they get through the school. So what are we doing about that? What can we do as a community or as a society to make sure that they are going to get the nutrition they need? They're going to get some of the basic needs that they get. And again, please do not be selfish. And when you go to the store and buy something, make sure you are thinking of others and thinking about the effect of your action on everyone around you. Now, when we talk about the economic implication now, today, in the US, for example, there is trillions of dollars that is wiped out from the financial market. This is, I know some people might think about this as this is a rich people issue, but no, when they lose the money, they're going to try to make it up somehow. And we're the one at the end will suffer. The market crashed. It is worse than, I think, 1987. And now they lost millions, trillions of dollars on the stock market. So how are they going to get that money back? And the malls, no one is going out to buy anything. So the market is going to crash down even more. What are we going to do? It is going to affect us somehow because they are going to force us to do some things to make up for that amount of money that they lost. And this is how it's going to work. Whether we like it or not, we are going to pay for it at the end. The economically crippled millions, especially since the epidemic has formed a perfect storm with the stock market crashed. This, not just the stock market here, the oil war between Russia and Saudi Arabia, and the spilling over of an actual war in Syria. I mean, all this issue in the world does affect us. I know a lot of people look at it and think this is happening outside of the United States. We're just going to worry about the numbers we have here. But everything happening outside in the world is going to affect us some way or another. Not being able to pay your bills is going to affect you. Losing your home, not being able to pay your mortgage is going to affect you. Some people are not able to seek medical help because they can't afford it. And today alone, I just learned that it cost $1,300 to check for the coronavirus. You have to spend that much to know that if you have coronavirus or not. If you go to the doctor, if you don't have health insurance, no one can afford that. And that is going to cause more issues because a lot of people won't be able to afford it. They're not going to go get tested, and then we're going to have more issues. So 1,300 to get tested for coronavirus. This is ridiculous amount, and I think what we need to do, we need to contact our government officials, ask them for solutions for working families, ask for solutions for if they can ask the companies, they can make the companies at least um, stop the mortgage payment or the rents or other bills. I know this is going to affect others. Like if you don't pay you pay your bills on time, you're going to affect the companies. A small business like myself and other small businesses are going to be affected. But we have to all work together to get this hard time until we resolve this issue, until we get to find a solution for the disease. Again, I am going to just repeat the key point we talked about. People are panicking. You have the right to, because it is scary. New things are scary. It's spreading fast, and it is affecting us here, even in the United States, affecting people everywhere. But don't panic to the point that you are going to, cripple your life. You're going to prevent yourself and others from doing your normal things. Just practice safety, practice precaution. Wash your hand, wash your hand, wash your hands. I'm going to put this up again. Wash your hands. Make sure you wear mask when you are sick only. Think about the first line defense. Think about the first frontline personnel. Think about the police, the EMT, the doctors, the nurses who are taking care of you. When you're taking everything, they're not going to have anything left. Please think about others while you're thinking of yourself. Remember what we said at the beginning: virus will not kill you if your immune system is good. And I'm not saying that 100%, because there is other viruses will kill you. I'm talking about the coronavirus. If you practice safety, you keep a 6 feet distance, you wash your hands, your immune system is good, you'll be good. It will be just like the flu. I'm not promising. So if something happened, you'll say you said that. But this scientifically proven, it affects older population, people with compromised immune system, people who are suffering from chronic medical issues. So please practice safety everywhere, and be safe, everyone. All right, so said, please give info about China experience. I believe, Jafar, I believe China currently is, they said they're cured. We cannot know 100% because we don't live there, but they said they are, there is no cases. Europe, what got it worse? Europe had a lot of issue, but they are recovering from it now. And we have a lot of cases here in the United States, but again, as long as it's contained, as long as you practice safety, I don't think it will be a problem. All right, so Esther said, what can I do if I haven't, if I have not doctor or health center, all the hospital in our region, they aren't able to define corona. We want sample tips to be away from this. Okay, all right. Yes, there is, it depends on where you're at in the world. They should have a way of testing the virus. They should be able to, even if they can't test the virus, they can do the process of elimination. They can check you for other things. And if you are not sick with those diseases like flu or a cold or anything, they will be able to put you somewhere, isolate you for until they do the testing, because it's better be safe than sorry. But I am not sure where you at currently, but do check with your healthcare provider, if the hospitals are not prepared already, which most of the countries are not prepared already for this, then just take precautions. Wash your hands, cover your mouth. It will take its toll. And when they keep you, if you feel you're sick, put yourself in the quarantine yourself if you can afford it. And I know a lot of people cannot afford this. So I hope this answered your question. Muhammad Sabri, about the mask. I see it's better that all uses it, not only sick people, because holder don't know they are sick in the first days. Yes, it takes 2 to 14 days for people to know that they are infected. You will feel other symptoms. If you're feeling, if you are going, like if you are Muhammad, if you are going somewhere and there's sick people around you, they should be wearing masks. The only time if you're not sick, you can wear the mask if the other person you're taking care of. If you're a doctor or a nurse, you have to wear it. But if you are going out to work and someone is sick, that sick person need to wear the mask because that protect everyone around them. And instead of having everyone wearing mask, you make the sick person wear the mask. If the sick person is unable to wear the mask, like an older person who is in ventilation or or they just not able to wear the mask, then you wear it to protect yourself. But I don't see a reason for people to just walk wearing masks. And again, it is not just about panicking and trying to protect yourself from something, but think about others. That mask you're using, you're taking it away from someone in frontline defense, someone that you yourself are going to need at some point if you get sick. And hopefully you are not going to get sick. Justin, let me send you the link right now. Here. Okay, so let me send the link, Justin. I am so sorry. So again, just to answer Muhammad's question, if you are not sick, please do not wear mask because you are depriving others from other people who do need it from using it and protecting themselves. Justin, I just sent you the link. I just sent it on the Facebook. Let me know if you got it. Hello? Send you the link. I just sent it. Justin, let me know if you got the link. I apologize, everyone. Justin is trying to come on the show, and I sent him the link. So we're just going to wait a few minutes until he joins. I sent it to your Facebook. I inboxed it to you also, Justin. Please check the group link. I don't know what it's. I copied the link and I sent it to you. All right. Let me know if you got it. So again, while we're waiting for Justin to come on board, if you guys have any question or suggestions, please drop it in the comment or follow the link, the invitation link that I just sent, and use it. Lisa, is that you, Justin? All right. I will put Justin up. Hello, hello.
Hello.
Hi, Justin. Everyone, this is Justin. Your side, please, buddy. All right, go ahead, Justin. We can
Yeah,
hear
I
you.
can't believe how people have issues getting on here. This is easy.
I know. Good. I'm glad you're here. Lisa said healthcare organizations are struggling to order PPE, which is personal protective equipment. Prepare. Lisa is a nurse practitioner. She's one good nurse practitioner, a good friend of mine. She said, prepare for possible coronavirus and are unable to find supplies due to the public panicking and ordering unnecessary masks, etc. So, Justin, first of all, talk to us about what you think. Um, we can see you.
So, yeah, I really wish people, I understand panic, but I really wish people would have taken a moment and thought about what everyone needs. And that's going to be really key as we move forward, that we actually consider what our community needs. You have to look beyond your own neighborhood or your own city.
Hmm.
Like that kind of forethought is what we're going to need. And yeah, there's going to be a shortage now, but I think we can overcome it as long as in the future people aren't just rushing out to buy 1,000 rolls of toilet paper, for instance. But I can actually give a firsthand account of healthcare organizations, and it's a little different. But my
Hmm.
friend's a dentist, and he uses, of course, masks when he's
Uh-huh.
doing dentistry, and they're out of them. He can't get masks at this point. So yeah, it's
Yeah.
scary. It's a shortage, and people who don't need them are getting them just, I don't know, to allay their fears or whatever, and it's unfortunate.
So you read what Lisa just said down there, and she's working in healthcare. So what I said earlier, this is affecting everyone, and not just in healthcare, doctors, nurses, respiratory therapists. I mean, all the healthcare professionals. It also
Mhm.
affect the police. It affect the EMT. It affect everyone that have a job that they cannot um, stay home without. So
Yeah, what's really going to be interesting is how we see it. We function as a society without 75% of the people working, which
mhm.
I think is going to be very possible, and
I want to hear
we're
your
gonna
thoughts
we're gonna
about
miss
this.
out on some things, yeah. But I think it really has also the potential of bringing us together to help each other, which I think could be a benefit in this society that's really individualized, and that's what we value,
Uh-huh,
unfortunately, instead of that communal kind of work. And that's what
uh-huh.
this needs. That's what the approach needs to the COVID-19. Like we need to work together, and maybe we can get more towards that.
Did you heard about the school closing, and you heard about the effect on the stock market, and when I said earlier, this might not affect you and me directly. This is affect the rich, millionaires or billionaires, but it's a system. It's going to affect us somehow. A lot of people look at it and say, this is the stock market. I'm not investing in a stock market. Why would I care? Do you care to explain why this is going to affect us? Also, when it comes to school closing, daycare closing, we're talking about people are going to be forced to stay home. What are they going to do with job when it comes to go to work?
Well, when you're talking about the stock market, I'm almost certain that's why the president had all the CEOs of the big businesses that are helping him, and that he was talking about the public private partnerships that he's creating or whatever. And I have no doubt that was to help, reinstill confidence in the stock market. And my thoughts on the stock market are not especially relevant to this situation, but
Mhm.
it may I'm definitely worried for the people who do have 401ks and retirement plans. That's where my biggest concern is when we talk about the drop in the stock market.
I didn't even think about that. You know, a lot of people have the 401k, and
Yeah,
that's going to affect them too. I didn't even think about that.
yeah. Uh, but it could really make us reassess what's important in these supply chains. We don't have to create, this mass of, cheap goods. You see how it's hit China. We've already seen a massive decrease in their pollution. We've seen,
Yeah,
a decrease in the number of, cheap goods that they create. And we're only going to see how that affects us in months to come. Like, we're not going to feel that right away because they've already made all that little stuff for now. Like,
yeah.
we're fine in that for now, except, of course, hand sanitizer, which is going for $800 a bottle, apparently.
I saw that, and that's what I mentioned earlier. A lot of people are using this crisis for their own benefit, and that's a very sick mentality, but it is what it is.
Yeah, the term that they've used for it, and I've heard before, is disaster capitalism, which rings true. And that's actually happened in any number of disasters. You heard, the hurricane in Houston a few years back, where people were selling, bottles of water for exorbitant amounts and gasoline, etc. This happens in all these crises. But the
Yeah,
difference being that, this is a nationwide, and I see your map, it's a worldwide threat.
yeah.
And
Do
it's
you see?
really something that isn't just localized to us.
Yeah, yeah. And were you able to read Maria? Maria made a comment or a question down there. I'm not sure how familiar. Lisa earlier sent me an article, a link about how Italy is facing a crisis because they do not have enough ventilators. And if people don't know what ventilators are, is that something is going to keep someone who is not able to breathe on their own alive. Without that, they will die. No question asked. So,
Yeah.
can you read? Can you see Maria's question and can you read and
I
answer
can.
it?
I don't know a lot about that, unfortunately, except the stories that you've heard. I think,
Yeah,
that there were problems, they don't have enough medical equipment. And that's one of the things that even Trump said that, you know, maybe it was Trump, I don't know. It might have been someone else. They're trying to stage it that not everyone gets sick at the exact same time, but
and
also,
how?
keeping it from the most vulnerable until perhaps, and you heard the timelines Trump was talking about, like some, or maybe it was a doctor, some vaccines take years and some vaccines take a little bit of time, a lot less. Hopefully it's a lot less. But,
Yeah.
pulling it off from the most vulnerable populations until there is some sort of preventative or some kind of vaccine, that would be the ideal. But, if you're healthy, ideally we would get it in stages, like a certain number, are going to get it now, but then, in a month and then another month and another month. So all the resources aren't, you know, stuck at one period of time and just overextended.
So, Maria, to answer your question, the information that I have is the article that was sent to me, and it's on my Facebook page. Lisa shared it with me earlier, and it's talking about the same thing you're saying now, but I don't know how truthful this statement or article is. And thank you for, did you read what she said about lunches? She said also, as far as lunches for children, some of the schools are providing back lunches and also some restaurants. I did not see that anywhere in the media, Maria. And if that's accurate, this made me feel really good because there is a large amount of kids who are unable to, not just unable. There, some of them are homeless. Some they depend on the food that they get from the school. But to know that,
Yeah,
do you have any
yeah.
idea?
That is the case, at least with public schools.
Mhm.
They will still be serving whatever meals they serve. I think some do breakfast for certain kids and lunches. They All the public schools in Pennsylvania, from my understanding, will still be providing those. I'm not sure about restaurants. I hadn't heard about that, but one thing in terms of food that I myself, and the nonprofits that I know are that we're trying to do is to set up some both a combination of things actually. One is a request, if you're sick and if you're stuck at home, or if you're just stuck at home because you were in contact with someone who
Who's sick?
was sick, but we could we'd like to be able to deliver groceries and needed supplies to you.
Mhm.
But also beyond that, just in cooperation with a few other nonprofits that I know, we'd love to be able to, provide, meal services to people during this time while somehow avoiding everyone gathering in a centralized location and having to get them, which is obviously problematic too.
That's a tricky situation, and I think that will be the issue with the food bank. I know there is food banks and there is other places that provide food for children, but the tricky part will be how to safely go there and get what you need without infecting other people or getting infected. I heard today that the Meals on Wheels, I used to volunteer for them. I haven't done that for a while, but I heard they are sending frozen meals to the people that they send, that they take food daily for them, to avoid getting them exposed, getting them sick, and to ensure that if anything happened, they will have enough food, which is a very good idea. But I'm so glad that the schools will provide, because I did not see that anywhere. But
Yeah, I mean, I working at the state, I get all these state emails, and it was part of, I think, today's press release by Tom Wolf
uh-huh.
saying that the schools would still provide those kind of meal services.
I
Um,
actually did see it earlier and I shared it, but it didn't click my mind, because I'm thinking in my mind the school will be closed and no one will be able to get in or
yeah, I'm
do
not sure
anything.
how it'll actually work in practice,
Mhm.
but if it can somehow work and not be endangering people by coming in touch with other people who may be sick, then that's really good. That's a good thing.
Okay. So what basically your intake of this whole thing? Um, the closing and its effect. I don't think you
Oh,
covered the part of the families. How are we going to pay the bills? I asked earlier. I said, if you can't go to work and the
oh,
government.
well, my
Uh-huh.
strategy would be to go back in time and elect Bernie Sanders, but that's not going to happen.
Yeah.
Under our current president, this is why I'm saying like it's got to be a community effort, and you got to ask people who do business and seek a profit, landlords, and people who are working with people to be able to hold off and take that hit. And a lot of people are in a situation who are landlords, they're not rich, they can't take a big
Yeah.
hit on that, so that funding has got to come from somewhere, and that's the real conundrum, because we don't see the Trump administration or the Wolf administration coming out and saying, yeah, we will fund paid sick leave, which was actually defeated in the or not brought up by the Senate today or
Hmm.
yesterday. There are all these little social safety nets, which is why you know in other countries, for instance Norway, like
Uh-huh.
they've had no cases, but they've shut down, and they have a robust social safety net, and they have a robust single payer healthcare system. So like they've already mostly got that covered, but we don't have that, and that's what makes it a lot more complicated.
Yeah. Yeah. You see what Tarek is saying. A lot of people got laid
Yeah.
off. I heard earlier, because people are not going to fly, which is understandable. A lot of airlines are laying off their employees. They're expecting 50 million job lost. So
Yeah,
I don't
that's
know how news
really
that. But
unfortunate that they just immediately jumped to that conclusion when you really hope that something could have been done instead without just firing people. I feel like that's a drastic cost saving profiteering move, and that's really unfortunate.
to lay off, and
You
again,
just immediately lay people off. And
some
also
is
you have people you don't have support from the government who
yeah.
just the other day threw $1.5 trillion blindly into the stock market instead of perhaps offering those loans to companies to keep people on, or not even loans, grants or loans, whatever, to those companies
Yeah.
to keep people on, to keep people working, to cover those sick days. You don't see any of that, and that's where I think we're really going wrong.
Yeah, and Tarek just sent another comment. He said that's true. The laying off of that large number is true, and that's really unfortunate because it is going to be like a snowball effect.
Yeah,
It's
and it's extreme, and it feels hasty.
and Bernie. I was listening to Bernie Sanders earlier. He said something that really got my mind. He said we need to fear our country and the world go bankruptcy, or face the bankruptcy more than facing death from this virus.
Oh
Us,
yeah. And much like in 2008 when we decided to save all the banks and just
mhm,
continue to prop up these failing institutions,
mhm.
that seems to be what we're doing. And yeah, Tariq, that's exactly right. That's what I think will help us sink or swim, that working together. And I already know people who will, but I'm really excited to see other people in the community who wouldn't normally be into that, and maybe that would start building those bonds of community even more. And we need more. Like the people we have now who are doing it, especially in this crisis, is not enough. But
Yeah,
perhaps this brings people to that conclusion, and gets them into doing this kind of thing even once the coronavirus is done.
maybe it will be a habit, and people will start helping each other from this point on. But again, there is another issue beside the economic complications and the issue that we're going to face with paying rent and all of the above. But also, we are going to have shortages. I mean, the people that are fighting in the front line now, some of them are going to get sick, and some already got sick. We're going to face nursing shortages, doctor shortages,
Yeah,
at
we're
least
already just
fighting for.
overstocked at our hospitals. I don't know
Yeah,
how we're going to handle it.
yeah. So, what would be? I know you probably listened to what we said earlier, like advice to people to stop and just think. What would be something that you want people to like hear and do, just like a normal person, just like you and I.
Well, I actually was talking to my parents earlier about all this and about the possibility that the state government itself is shutting down next week. We know nothing about that yet. We don't know if that'll happen, but it seems very possible, which, would I think help a lot of people whose kids can't, you know, go to school. Like, what are you doing? Like, if your job is not shut down, if your place of work requires you to go to work and your kid's home and they're not of an age they can stay by themselves, what exactly are you going to do?
Why, as a
It's a
nurse and
really
as an
difficult situation.
option, right?
Hmm?
I
Yeah,
said
what's the other?
even if your job does not require you because they force you, some people do have to be there. Nurses, doctors, police, EMT, they have no option of saying I can't, or so those this is going to be a real struggle. We already have shortages as it is.
Absolutely. And, you know, I don't know. I'll do this in steps. First, of course, take proper safety precautions. Wash your hands, use hand sanitizer. Probably not as much as some people are doing, which seems a little bit much, but absolutely wash your hands. Don't touch your face. You know, if you got to sneeze, do it into your elbow. All the basic stuff we should all know by now. Be careful about being too close to people, because I heard a distance of 6 feet is safe, and I don't know if that's the case or not. Certainly, if you're in a room that is enclosed, and circulates air, try not to be in that room if you can help it, because I don't think that's at all helpful. So you
Mhm.
got those basic steps first. Uh, when we're saying, stock up on necessities, it's going to be a little tough now. Like a lot of places are sold out, but
Yeah.
you can get things that are going to be good for months and months. You can get canned soups, you can get canned beans. The other day I got dry beans that you can rehydrate, and they last for a year or more. Like you have all this non-perishable stuff, and they're good things to get. In terms of toilet paper and stuff, that's really unfortunate, and I don't have any good advice on that. If
That
you
because
don't already have it, that's crappy. No pun intended. I swear I didn't intend that pun.
what?
But uh, in terms of all these things that are missing, in terms of food, in terms of childcare, in terms of all these other things, work together. If you have to start it, start it. If you know someone or you're talking to your neighbors and stuff, and they are starting this sort of organization, I already know one that's happening in Midtown Harrisburg. If people are interested in that, they can get in touch with me via Facebook. I think my Facebook is linked on here. I think,
Yeah.
but they can get in touch with me that way, and I'll connect you. And I'll also take your info if you're from somewhere else and want to start, getting that network together. I can definitely help with that too. But there are a lot of different options that we could create. We could
Mhm.
have childcare. We could have people who are staying home that you trust, of course.
Mhm.
You know, in those childcare roles. Like if the state gets closed down next week, and your place of business is not, and if you're not able to telecommute, some people could you know choose whatever role that is most needed or whatever is best. They could if they are into childcare, they could engage in that. If they want to cook for people who are unable to do so, if they want to run errands and safely drop it off at their house, they could do that. There's a lot of stuff that needs doing. So I just really encourage people to either start it or get into something that's already going, but safely, of course, to reach out to your community in this time where people absolutely need it. And I think if we do that, we will be surprised at what happens after. The sense of community that will start to build. And no man is an island. I take a village to raise a child. All these little sayings,
Sayings that
they're accurate. They're actually accurate. They might seem silly or corny or whatever, but it's true. Like we are a social species. We cannot live on our own. That's
isolate.
just impossible. So maybe this, as bad as it will be and as bad as it's going to get, and it may get bad, just straight up, it may get bad. But in the afterwards, we may develop a sense of community that, will grow and build. Or if we don't, we may, encounter that sense of separation and conflict. And you may see things like, like we saw today, like people fighting over toilet paper at the grocery store, and
Unfortunately.
crazy stuff like this. And
Mhm.
I don't know, it's going to go either one of two ways, and somewhere along that continuum, not extreme, but I really hope people choose the way of cooperation and togetherness.
And speaking of toilet paper, people need to know this is not an E. coli. This is not a stomach bug. This is not something is going to make you go to the bathroom. As far as we know so far, you don't need to panic and get all the toilet paper, and that would cause other issue because if some people are not able to use the hygiene, a good proper hygiene, this is going to get us into another kind of bacterial infection or virus infections. And please, if you don't have paper towel, use water, use something, but don't just contaminate everything around in your house. And we have Heather McDonald. Actually, Heather is a running Heather for PA. If you are listening now and you're in Pennsylvania, go to the Facebook page for Heather McDonald. She is running, and we are going to have her at some point on the TSO the following Monday, not this Monday. She is going to be with us talking about her plan and what she's going to do and what she, her bio and everything. But Heather said, what can the average person do to contribute to the overall health of our neighborhood, friends, and family? Um, we mentioned that earlier. Justin, do you care to talk, and then I will go
Yeah,
after you?
just if you have older or vulnerable at risk people in your community or your family members or your friends, get in touch and stay in touch with them.
Hey, Maya! She can't hear us, I think.
Yeah, probably not.
Hear us.
Hi guys.
All right.
Hi. Welcome. Justin, sorry. Finish what
Hope
you're
everybody's
saying.
being safe. I'm sorry that I'm joining late.
We're trying.
Yeah. Anyway, just give me a minute. So
Answering,
what
answering
you
Heather's question.
you just keep in touch with the people who you know are vulnerable, and if they need those things and you can do it, you should do it. Or if you can't, you should look into becoming part of one of these networks that are popping up. And I talked to a friend of mine. She said that these networks are popping up in other places too. So, keep your ear to the ground, if you will, for these. And if there isn't one where you are and you're able to do so and you want to do so, you should do so. And just be sure to watch out for those who can't do so for themselves.
And I'm going to just add to what Justin is saying, Heather. I mentioned that earlier for your neighbor, for your friends, or your family. What can you do? Is try to protect yourself, practice safety, practice hand washing hygiene, practice. Can you hear us, Maya? I muted you because we can hear the car and all of that. Can you hear me well?
Are y'all able to hear me?
No, we hear you. We can hear you. But
Can you hear me now? Can you
I
hear
can
me?
hear Justin, but I can't hear Hygier.
we sounds like the Verizon commercial. Can you hear me now?
I see her pretty
Anyway,
smile, but I can't hear
Can
her.
you hear me now?
oh, you heard me. Heather, I said earlier, wash your hands. Don't share food
I
with your
can't hear any. I
family.
don't know why I can hear
Don't
Justin, but I
share.
can't hear.
Don't share. Don't share drinks. Don't share food. Make sure you use the sanitize your home. If there is no water, you have no access to running water, use hand sanitizer, but it has to be a at least 60% alcohol with your hand sanitizer, if you have any. Everything else is gone from the stores now. But if your neighbors are sick, advise them to call the doctors ahead, to wear mask. You wear mask only when you're sick. If the person is sick around you, cannot wear mask like an infant or an elderly person. You wear mask to protect yourself, but do not just wear mask for the heck of it.
Yeah, but also, if you don't need a mask, like what you were saying, don't just go buy a mask. It's more important for the people who are sick, even more so than the person in the room. That's important too, absolutely. But
Right.
people who are sick need those masks, and doctors and
Absolutely.
nurses need those masks. So don't just buy them for the heck of
And
All
if
right,
I could say,
Mario.
what I've noticed a lot since all of this, has, increased and gotten, I guess more people are becoming more aware. You do see a lot of people, like today I went to work and a lot of people are wearing masks and a lot of people are wearing gloves. And if you think about the people who, to be honest, who really need it, it just puts in perspective that for one, we are very selfish people. And I
That's
saw
what I
that
said
yesterday when
earlier.
I went
Thank
into the
you.
grocery store and they were fighting over, a roll of toilet paper, okay? We are very selfish people, but this is not the time for us to be selfish. We should all be working together. A house divided does not stand. So we should all be coming together as a family, wanting everybody to be better. But instead, we fight over the things that we really shouldn't even be fighting over, to be honest. Listen, you don't have to have toilet paper, okay? You can use soap and water. It's not that serious, okay?
Exactly.
It's not that serious. And I've seen it today. A lot of people wearing masks and gloves, and it really bothered me. And then I asked one person, like, what, do you have the coronavirus? She was like, no, I'm just trying to protect myself. You're not protecting yourself. You're making yourself more susceptible to it because you're washing your hands less frequently. People just aren't thinking, and we need people to
And
think right now.
you're
This
taking
is
the
a
gloves and the
pandemic,
mask
and this
from
is
the
not going to
one.
go away if people continue to be selfish. It's not. It's going to
And
get
that's what I
worse.
said earlier. My selfishness is what we're seeing now. And by taking the mask and the gloves, like you work in a store, there is no reason for people to wear masks and gloves unless you have a customer coming in who is sick, actively coughing, who's supposed to stay home, but they decided to come for some reason and get a phone. Then you know what? I will make them wear a mask. Maybe the stores can have someone sitting on the front. I'm just giving suggestion. And instead of having their employees wearing or allowing their employees to wear masks and gloves, have someone stand in the front door or by the front door. And if someone is sick coming to the store, you have the right to tell them, please wear a mask, wear gloves to protect yourself and your employees. But it is just ridiculous to take away all the supplies and deprive the healthcare, everyone that who actually will need it to survive. Um,
Yeah,
can you read Heather's message and respond just then?
yeah, that sounds great. Excellent
Before,
advice. I'd like to give people advice to utilize services like Peapod and Instacart to have groceries delivered, but I'd like to keep the health of the Instacart employees in the front of my mind too. Thoughts? Yeah, that's tough. I feel like they need to make special precautions. They need to put thought into that. Both the, I think that should more so be on the grocery store though, and the Instacart service. To guarantee the safety of the employee and of the people who are delivering it. Which also brings up the idea of service workers, fast food workers, and salespeople.
mhm.
They are right in the line. Like you see more people a day than almost anyone else. And
Yeah,
Absolutely.
I'm thinking of you. Like you,
Maya
I
too.
mean, if anyone's wearing a mask, it should probably be you instead of people who coming in to buy a phone.
I definitely agree, but like we were told today, or what I heard is that um, what we need to do is just wash our hands and not worry about a mask. Which, in my case, as a single parent, that really scared me. Because I am at risk so much of being around so many people at one time. It does scare me. Um, but I mean, what did they say today? They said how do you say it?
Essential.
Yeah,
Non-essential
non-essential retailers would be
now.
closed. We are
Mhm.
considered essential. So we're going to be
Why?
pretty much in the line of fire
Why?
until it is, taken care of. I don't know why I can't hear anything that Hygeria says. All I can see is her pretty smile. So Justin, you have to let me know what she says because I
I
can't
She
know
see.
she
why.
said, "Why?
You are
Why?"
not the first. Yeah, why? You're not the first.
I asked the same question. But I guess because we are in, like, we are part of the telecomic communication. Everybody needs to be able to stay in communication with everybody, so that's why
Mhm.
we are still there. So I
Okay.
mean, it's a lot, but one of the concerns that I raise is that I have a illness in my family. My stepdad has been ill for um since December of last year, and with me being on the front line, I've kind of, if you want to put it like that, I feel like I am more successful to getting it and passing on to him because he is a lot more vulnerable than me. You know
Yeah,
what I'm trying to say? So
yeah,
I mean, it's very scary, but I mean, what can you do? And a lot of people who are in lower pay grades. I mean, even if they did shut down these who are non-essential retailers, these people aren't getting paid.
exactly,
They're not
exactly.
going to have any money, so they're going to be in debt, stressed out, Stress causes sickness. I don't care who wants to argue with me. Message me. Stress causes sickness. Okay. So they're gonna be in debt, stressed out, and worry about how they're gonna put food on their tables. And let me tell you something. America is not like Italy. Okay. They are, I don't believe that they will pay for the mortgages or postpone mortgages or do
Yeah,
anything like that for people, because we saw during Hurricane Katrina, we saw through all these past hurricanes, you still have to pay regardless.
yeah,
So I mean, I feel even though I still have to work and I'm in the front line, I do feel bad for the people who are in a lower pay grade, who are in those retailer stores, who are gonna be out of work, who are not gonna get paid and not gonna have that money to pay their bills. Because you know what? When all this is said and done, they're gonna be the ones who are truly gonna suffer for it.
yeah.
Oh, absolutely. So yeah.
You have to tell her what I said after I say it. But to answer Heather again, your advice is very good. It could work if the people who are delivering the food wearing masks, if the people who are on the other
Again,
side
your
receiving
advice
and
is
the
very good.
receivers,
It could work
Maya can
if
hear me now.
it could work if the people who
If the
are
other people who are receiving the
delivering
food are able
masks
to wear masks or try to keep themselves safe and keep the delivery person safe. And that's not just for the services
Oh
like
yeah, I have put it on my other phone so that I can hear you.
good, I'm glad you did. So the delivery services could work, Heather, but we have to be all cautious about people coming into your house. I mean, like you can have them deliver it to the door and just hand them the money or pay online. But this is will cause a lot of issues, I think. And I believe half of America already like went to the store and bought a year worth of food, and the one that didn't get it, they're gonna, if there is an issue, they're going to starve to death. We lost Maya, but anyways, hopefully, what we just heard answer your question, Heather. But I think this will pass. Justin, if you agree, but we just have to stay calm and we just have to not allow this panic to make us all going in circles and losing our humanity, losing our sense, like common sense, in acting in a
Mhm.
crazy way.
Yep.
What do you think, Justin?
They say that, crises, and especially ones like this, it brings out both the best and the worst in people, and those
Yeah,
tendencies are absolutely there anyway.
yeah,
But when, I don't know what kind of metaphor I'm trying to use. When the pedal hits the metal, when it comes to it,
should
when
hit.
when you lay your cards on the table, like
Yeah,
that's when you really, find out who you are as a people, I guess. And I guess I just have the hope that people are going to come together and instead choose to work together and bring out the best in each other instead of the worst. I just saw a message saying, please share facts and not fear. I hope we
yeah,
are. I hope that's what we are doing. We're not trying
yeah.
to scare anybody. I don't.
Oh,
I
no,
think I think it's good to be wary. It's good to be aware. Like you should
that's
be
not.
careful, but
I share that. No one commented that.
oh,
I put that up there. Tariq said he's cutting labor charges half. Hopefully, that can make him survive paying his dues.
yeah,
And we hope everyone else in the country is able to find a way. We hope our government can help. If that didn't happen, we hope the community can come together and help each other. I put down the please share facts, not fear, and that's for everyone out there, not just us. We're trying to be, to be realistic as much as possible, to be optimistic to the best of our ability with this situation. And we're trying to share facts and trying to discuss suggestion, not make someone scared or and I said at the beginning, it is a scary time because it's unknown. The unknown is always scary, but this is just like any other virus infection. The only difference is this is new. It's coming down fast, affecting a lot of people, and it is causing a panic because of everyone how they acting and reacting to it. Anyways, do you have anything else to add before we sign off, Justin? Or
Yeah, just in this.
Mhm,
You yourself may not be vulnerable. You may be young, healthy, whatever. Although you still might, it might go badly for you. You're probably healthy. Like
mhm.
that's great. I'm glad for you, and that's probably me, and that's probably Hajir, and that's probably Maya, and that's probably a bunch of other people listening to this. I can almost guarantee that you have someone in your life who's not. You have someone who is immune compromised. You have someone who is old. You have someone who is another way vulnerable. You got to think about them and the people beyond that that you don't even know. That's what's more pertinent in this. Like you got to think beyond yourself. Like you got to not, you know, be self.
Yeah. But I hear you and I agree with everything you just said. And so Maya got disconnected. Come back. Love you too, Lori. I wanted you to come so we can hear your thoughts and or read your comments. Or if you are available now, I can have you come in, but we're almost done. Anyways, please learn the facts, share facts, and don't panic and cause more issues. And please think of other. Think that you are going to be, hopefully you're not going to need to go to a hospital, but if that happen, you want to know that there is people there who are not sick are able to take care of you. And the main way you can ensure that is by letting them have what they need, the essentials. Personnel need to have essential equipment to protect them and so they can be out there protecting you.
Okay. And this is something you probably touched on before I came on, but don't, yeah, if you don't need to go to a hospital, don't go. If you can avoid going to the ER, I'm not saying, put your life at risk, but go to like a smaller off-site, go to an urgent care facility, go to your doctor's office. Try not to go to these places where a lot of people are going to be looking for care and a lot of people may be sick.
Yeah.
Reduce I believe it's called a vector, disease vector or viral vector. Reduce that as much as possible. Stay home if you can. If you are living with roommates who are sick already, do everything you can to help them, but help them stay in their own room and not infect anybody.
Mm-hmm.
If you're sick, don't leave your house and, look for these services that are really hopefully going to be popping up in your community.
Yeah.
And we also need to not hide being sick. There's a lot of horror stories and fear probably that people might have saying, well, I'm sick, and people shun them, or they might even be violent to them. Hear I think fake news in North Korea that people are getting shot, but people are actually believing that that's true.
Mm-hmm.
And that's the kind of thing this is the kind of thing that if you have it and you don't tell anyone and you encounter other people, you could very easily infect them. And if they're not of strong immune system, they could be very seriously sickened or even die. So this is not a time to be hiding anything. This is a time to just be open and honest with the people in your community. And we act like it's a bad thing in America, but it's not. Ask for help. Ask for care. Ask for the support of your community. And in the future, remember that. And if someone else needs that help and support,
Help
you be
them.
there for them. It's not taking, if you're giving back at some point. And if you can't give back at some point, that's okay too. It doesn't mean you're not valuable. It just means that you need help, and that's not a bad thing. So don't be afraid to ask for help.
Yeah. And Lori is one of the good nurses that I work with. She's a good friend of mine, but she says she's a home care nurse now. And she said, as a home care nurse, I need my PPE, which is personal protective equipment, in
Okay, I
simple,
want to know that.
their masks, their gloves. And she went on and she said, masks, soap, and sanitizer are all on back order. And this is just ridiculous. She cannot take care of her patient because they're in back order. They're all gone from the stores. The medical equipment don't have enough to cover everyone. So now she is risking her life taking care of patient because some person was selfish enough to buy everything on the store. And she made a good point here. She said, does the general public know the N95 mask? You know those big masks? They're not one size fits all. She said, does the public know that? And that's a good comment, Lori, because at the hospital, you have to get measured. Like they fit it to measure, they measure it to fit your face. You cannot just go out and buy anything. If it's
Yeah,
if it
I wouldn't have known that. I would not have known that.
at the hospital, you have to get measured. Doesn't fit your face, it's basically not working or not helping. So you are absolutely right, Lori. People need to know, educate yourself. Ignorance is not a bliss all the time because
Right.
you could spend all the money and buy the N95 mask, the big mask. It's not going to protect you if it doesn't fit your face well, and you're depriving healthcare personnel and essential personnel from protecting themselves. And Maya said, drink plenty of water, wash your
Yeah.
hands and body.
Absolutely. Drink if you feel yourself getting sick, drink plenty of water. Flush your system out with water. You want to stay away from sugary sodas or different things like that. That's going to make you build up mucus or give you all that sugar. You don't need that.
Mhm.
Water, water, water. Even if you can't drink water unless it has a flavor in it. Listen, Giant has a water 10 for 10 right now, and that smart water that got like cucumber lime in it. Take advantage of that and drink it. Because you know what? To be honest, our bodies are affected, for one, how we take care of our bodies before we're sick. What we're eating and what we're drinking plays a major factor on how our body fights off viruses and illnesses. So if you are not eating right, if you are not drinking right, you are going to be affected in some kind of way. I'm just going to throw it out there and say it. You got to take care of yourself. So drink plenty of water. Make sure you're eating right, and wash your hands and your body. Okay? Just like I don't know what the doctor's name was that was on the conference this morning, but just like he said, like, body hygiene, not just your hands, but your whole entire body.
And
Okay.
in million years, Maya, in million years, I did not, think we are going to discuss this and tell people wash your hands. And
Right.
this is something you expect people to do normally.
Right.
And going back again to buying the sanitizer, Lori said taking away from the frontline workers, like Lori, like Lisa earlier, what she said, like you, Maya, a lot of people that are out there fighting and they're not able to protect themselves. So, this is
Right.
again selfishness. I hope everybody that listened to us today got some information. The least you can get out of this, please don't be selfish. Consider others. When you think about yourself, think about others. Other safety is part of your safety. Even if
Right.
you're going to be selfish, think about it this way. When you take all the masks and keep them at your home and the hand sanitizer, other people outside are going to be vulnerable. They're going to get sick and it's going to come and bite you in your behind. So even
Right.
if you want to think about it, based on you, think about it this way. You are going to lose. So let people help you. Let people have
Yeah.
what they need. The like the nurses, like Lori said, don't take it away from the frontline workers.
Right.
Yeah, and
And
just as we close, I'm not sure if you want to speak on anything in particular, but before we do, if you are interested in forming, a cooperative neighborhood organization, or if you would like any advice, or you have any ideas, or if you do end up starting one and want to offer that, please get in touch with me or Hajir or Maya, and just we'll keep track. And then if people are in your community and they want to find that, like, we'll direct them to it,
Right.
because I feel like these little cooperative organizations are going to be really important in the upcoming weeks or months.
Right.
it's especially for the people who cannot leave their house,
Yep.
early. Again, I'm going to say, Maya, if you have anything to say before we end this show? Maya,
Oh yeah, I'm sorry, you broke up. I didn't hear what you said.
I said, do you have anything to say before we close?
I just want to tell everybody to be safe. Please wash your hands, and please think of others and not just yourself, because there's going to be a lot of people out here who still have to work, who may not have the best of health, that will be at risk. So please, to prevent other people from getting sick, please wash your hands, wash your bodies, and just think of others.
Yep.
I beg you. I'm begging you, please. I can't hear Hyger if she's talking. Are you still there, Justin?
Just if you are interested in forming your own community-based cooperative organization or group to help people, or you want some tips, or you have some tips, get in touch with myself, Ajir, or Maya, and please, we'll help, and we'll help get those organizations networked together so that we can all help each other.
All right. Well, thank you everyone for joining, and for the ones who just joined us late. We hope you can go back and watch the video. And if you have any suggestions, you can write it. We'll contact. We'll respond to it. If you have any suggestion on how to help and you wanted us to be part of it, let us know. You also contact Maya, Justin, or myself. And thank you for being here. And thank you, Justin. Thank you, Maya. And thank you, everyone, for being a part of the change. And like Maya says, always be the change.
Always.
Always. Love you all.
All right, love you guys. Everybody be safe.
Be safe.